Hassan deaths heart attacks increased by 4 in post-COVID era, says Karnataka Health Minister. The recent spike in heart attack-related deaths in Karnataka's Hassan district has sent shockwaves across the country. Karnataka Health Minister Dinesh Gundu Rao has told NEWS18 that cases of heart attacks have gone up by about 4% on average Indiana the post-COVID era as compared to the pre-COVID era. He also pointed out how more people were coming to hospitals for heart-related check UPS. People coming in large numbers to check is a good sign. They are worried and want to lay their doubts to rest. If they do come, we are able to identify issues they didn't know they had, and treat them early. So this increase in the number of people coming to hospitals and checking themselves is a good sign, he added. At the Jayadeva Institute of Cardiovascular Sciences, patient numbers have surged by 25%. The main center in Bengaluru, which used to see 1,200 and 1,300 patients a day, is now handling nearly 1,800. In the Mysuru branch, the average used to be 700,800, but it has now reached 1,000. Similarly, in Kalaburagi, the number has gone up from 400 to 600. So across branches, there is a noticeable 20-25% rise in Indiana patients visiting the hospital, said Jayadeva Director Dr. Ravindranath. The panic stems from a disturbing trend in Hassan, where 22 heart-related deaths were reported over just 40 days, many of them in people under the age of 45. According to reports, 5 of the deceased were between 19 and 25, and 8 were aged 25 to 45. Only a few were above 60. Heart attacks are occurring in India nearly a decade earlier compared to the West, said Dr. Ravindranath in an interview to NEWS18. At a large facility like Jayadeva, we see around 200 to 250 patients in the emergency department every day. Of these, about 30% are with heart attacks and 20% of those are under the age of 25. So we are seeing a clear rise in young patients suffering from heart attacks. The State Health Department had formed an expert panel led by Dr. Ravindranath to study the pattern of deaths in Hassan and examine whether external triggers including COVID-19 or vaccination could be involved. The committee analyzed sudden cardiac arrests, strokes, and neurological events. There could be multiple causes like heart hypertrophy, reduced heart function, or dilatation of the heart. It's not always related to the blood vessels, Dr. Ravindranath said. We need to analyze this thoroughly, including whether these incidents are clustered around particular months. Sometimes media reports may label a death as a heart attack without proper confirmation. So unless we conduct a detailed, scientific examination of these cases, we won't get an accurate picture. That is exactly what we are trying to do now. Children are also becoming part of this trend, with rare but alarming cases of cardiac-related deaths reported in those under 20. Though rare, we are now seeing heart attacks in children as well. That's why some are examining whether there's any link between vaccination and these incidents, said Dr. Ravindranath. Many studies have already been done on this, and while more data and advanced testing may be needed like myocardial biopsy or histochemical analysis, current evidence shows no link between vaccines and these deaths. He pointed instead to other likely causes in those under 20, it's rarely due to blockages. It's more likely due to conditions like hypertrophic cardiomyopathy, dilated cardiomyopathy, Brugada syndrome, or long QT syndrome, all of which can cause sudden cardiac death. Heart attacks in this age group, he said, usually occur only in rare cases such as congenital coronary artery anomalies or genetic disorders like familial hypercholesterolemia, where LDL levels can spike dangerously high. The increase in heart-related visits has also provided doctors a clearer picture of current health trends. Most of these cases are not cardiac, but people want to be sure, said Dr. Ravindranath. The Jayadeva team has observed smoking as the most common risk factor among younger patients. Swipe left for next video. We're currently conducting a premature coronary artery disease registry. Among patients under 40, over 50% had a history of smoking. Around 15-20% had hypertension, Oregon diabetes, 25% had cholesterol issues, and obesity even in children is rising due to fast food and excessive screen time, he said. Preliminary analysis also points to a post-COVID rise in common risk factors. Hypertension, diabetes, cholesterol issues, and obesity have all increased, Dr. Ravindranath said. Latest blogs.